Welcome to The Spine Guy. I'm Dr. Brian Sue, a fellowship-trained spine surgeon in Marin, California. The Spine Guy is a channel dedicated to making the complex spine simple for patients to understand. I'll be posting videos weekly, so don't forget to hit the subscribe button to catch them as they come out. Today we're going to talk about lumbar disc herniation. Lumbar disc herniations are one of the most common things that I see in the clinic and one of the most common surgeries that I do. Here's low back, patient's back, buttock, belly looking from the side. The last bone here is called the sacrum. We call that S1. This is L5, L4, L3, and we count upwards. The disc is like a cushion or shock absorber between the bones, and the disc is named by the bones that sandwich it. So this is the L5-S1 disc because it's sandwiched by the L5 and the S1 bone, L4-5 disc, L3-4, L2-3. The nerves are on the back of the spinal canal. They run down and they go through your buttock down the legs. So how does a disc herniation present? Well, one of the most painful things that I see in the clinic is a person with an acute disc herniation. Acute just means it was sudden onset, and typically these patients present with acute sciatica. Sciatica is simply a term that talks about irritation or compression of the sciatic nerve. The sciatic nerve is in fact a bundle of nerves that are a confluence of the lower lumbar nerves, L4 down to S2, that come down, form a rod-like structure or a cable-like structure that goes all the way down to the buttock and leg. This is the patient's left leg. There's the butt. So the sciatic nerve is here. By then, all the nerves have already come together to become the sciatic nerve. The sciatic nerve comes all the way down, and it goes all the way down to the tip of the foot. Patients that have sciatica or pinching of the sciatic nerve experience pain in different areas and weakness in different areas. And this is because a nerve does two different things. One, it supplies sensation, and two, it supplies motor control, meaning the nerve plugs into a muscle, and if the nerve is compromised, the muscle becomes weak. We're going to talk about different muscles and what to look out for, but here you'll see that when you pinch the L4, L5, or S1 nerve, which are the lowest three segments, the L4 nerve comes down the front of the leg to the inside of the leg. The L5 nerve goes around the outside leg to the big toe, and the S1 nerve is primarily back in the buttock, down the back of the leg to the outside of the foot. Disc herniations can happen either from doing an activity. It's pretty common that I see a weightlifter try to do a bench press, or somebody's playing tennis and all of a sudden they get back pain associated with buttock and leg pain. Disc herniations can sometimes begin with just back pain, but as the herniation becomes worse, the nerve starts to get pinched, then you start getting sciatica, which is inflammation of the sciatic nerve. So let's talk about the lumbar disc for a minute, just so you get an idea of the anatomy. So once again, here's a disc. It's like a little shock absorber. We already reviewed basic MRI anatomy in a previous episode, but I'm going to show you here what a lumbar disc herniation actually looks like. On the left side of the screen here is what's called a sagittal or side view. So back, buttock, belly, S1 bone, L5, L4, L3, L2. And these are the nerves here. They swim in this white stuff, which is fluid. And you'll see this is a normal looking disc. So disc is like a jelly donut. So jelly inside, hard donut outside, protected from the nerve. And here you can see that the donut layer tore, the disc has herniated out and it's hitting the nerve. This is the equivalent cross section, which is slicing at L5-S1 and looking on cross section. So there's a cross section of the disc. The nerves here, nerves look like strands of spaghetti. Here nerves are cross section of a strand of spaghetti, which is a dot. But here's the disc. This happens to be the left side of the patient. And this is normal over here. And here you'll see the donut layer tore and the jelly spit out. Thanks for watching. Don't forget to click the like button and leave questions or feedback in the comment box below. Feel free to let me know what videos you would like to see in the future about the spine.